Kindness is the language that the blind can see, a quote by Mark Twain. Helping visually impaired people at Moorfields Eye Hospital. When helping, begin by introducing yourself.
So it's very important that anybody offering help to a blind or partially sighted person introduces themselves. So you could say, I'm a member of staff, for instance, so that it's not just somebody coming up to them who they don't know.
Ask if they need help.
Ask first. Just say, how would you like me to guide you? Do you want me to hold on to your arm, or do you want to hold on to me? You know, and I think that's the first thing, because everybody is different.
Let them take your arm.
Well, there's a technique called sighted guide, which is basically the way that somebody who's blind or partially sighted can take hold of a sighted person's arm and be led. But rather than the sighted person grabbing onto the blind person, it's the other way around. So it gives control to the blind person. And they can either pull back if they feel they're going too fast, or push on if they want to go a bit quicker. And also it means that the sighted person is going first, so if there's any obstacles or steps or anything like that, they're going to get there first.
Warn about obstacles.
A little bit of description, we're just going down here or we're turning left, is sometimes quite useful because you can anticipate which way you're going to move. I think obstacles are quite useful. There's a chair coming up on your right, or there are some people coming towards us. We need to be a bit careful.
The things that you really need to warn people about are steps and things like that. If you come to a door or to a narrow space, then as somebody who's guiding a person, you would just put your arm behind your back so that they would then naturally follow you in line.
Guiding someone with a guide dog.
If you're guiding someone who's got a guide dog, you must always go on their right, because the guide dog will always have been trained to go on its owner's left, so you must go on the right, so the dog stays in the owner's left hand. If I'm being guided, though, by a member of staff, I've then dropped the dog's handle and it's just resting on its back. He is not guiding then, he is just a dog on a lead walking along. So if I'm being guided, then the person is guiding me. They are doing the avoiding of obstacles.
Cues. Explain where to join.
Sometimes cues can form one way, sometimes cues can form in completely the opposite direction to last time you came. Sometimes the cues are going straight out the door. And it can be very hard to find your right place. And people don't like it if you push in. We're very British and we like to cue.
Place hand on back of chair.
When you're led into a room, if the person who's guiding you takes your hand and puts it on the back of the chair, you can then infer the shape of the rest of the chair and find your way into it. If, as very often happens in the worst cases, they try to back you into the chair, then that's the worst of all scenarios, because then you're sort of backing into space. You don't know whether there's anything there at all.
Dealing with guide dogs.
If you like dogs, a lot of people don't, but if you do, resist the temptation, please, to talk to the dog. It's had a couple of million years programming to be chatty and gregarious and talk to people. It's had 6 months training to be a guide dog. So what's going to win, given a choice? So if you can avoid leading it into temptation, leave it alone. That would be good, and it will stay calm and not get in anyone's way.
Consider the person behind the eyes.
You've got to be conscious of the patient's experience. So for some patients, they will have had sight loss for a long time. For other people, it may be quite recent that they've experienced this, and they'll be very hesitant about getting around and feel very vulnerable. But generally speaking, by offering somebody help and offering them an arm to hang on to, you can gauge how vulnerable they're feeling and how much help they're going to need.
Remember, introduce yourself, ask if they need help, let them take your arm, guide from the right, explain where to join cues, warn about obstacles, place hand on back of chair, don't distract the guide dog. Consider the person behind the eyes. You've been listening to David Samuels, Angela Smith, John Thomas, Shadeen Rose, Tim Gebbles. This video has been produced by Moorfields Eye Hospital.